want to say thank you to everyone for coming. This is a big moment for us. We have a big birthday tomorrow. We are two at Stripes Beauty. And this is Menopause Awareness Month, as many of you may know, and Menopause Awareness Day tomorrow. So we wanted to just bring everyone together, our community that has been faithful and been here, and celebrate specifically the vagina. Because lots of great things happen within, by whatever the vagina, and so and I know that many of you you may be in the perimenopause or menopause or getting prepared early stages, and so you need education, you need support, and this is something that I learned the hard way. This is badge of honor, like a microphone it can be. Sorry, I'm trying to throw my voice to the back. But we, badge of honor is our hero SKU for a reason, because women wanted support, they wanted skincare, not just for here. It's down there too. So firstly, I just want to say thank you to our great doctors here. We have Dr. Salas-Whalen and Dr. Hirsch, who are menopause experts, both of them, internist and a endocrinologist. And so thank you for being here. I want to just ask you straight away, what is the connection between hormones and vaginal dryness?
Yeah. So, when I used to teach, all the lovely residents at Harvard, we would teach about genitourinary syndrome of menopause, or GSM for short. And as women go through menopause and we lose our estrogen, which will happen if we live long enough, we will lose our estrogen. What happens to the tissue is it goes from a basic pH, it goes from an acidic pH like 5 to a more basic pH, say 6 or 7. And at that pH, it doesn't do the same things that it does when it lives in that acidic environment. So it's not going to make moisture, it's not going to lubricate the tissues, it can become dry and cracked. So there's a statistic that 50% of women will experience GSM, but I always say it's 100% of women, because all women will lose their estrogen, I know, and then that pH will go from an acidic to basic. So taking care of the vagina is so important.
And I can say, in the regards to how the hormones work, I can tell you what's normal, what estrogen does. We have receptors for estrogen all over our body, but talking specifically in the vagina, we have receptors there, and the function of estrogen there is to maintain moisture, to maintain elasticity of the vaginal tissue, right? It helps the glands lubricate the vagina. So when we lose estrogen during perimenopause and menopause, so we lose that protective effect in our vaginal wall. And that's why we have those symptoms of vaginal dryness, discomfort, pain.
Yeah, and so what can we do to avoid that? Like what are the steps?
Definitely being very proactive, right? The first sign of having some symptoms of vaginal dryness, and that's going to translate as vaginal discomfort or pain with intercourse. I think that's very common, what women express, is to talk to your doctor and see what stage are you in during your perimenopause, menopause transition, and with the possibility if hormones are an option for you, and even if systemic hormones are not an option, local intravaginal estrogen is usually universal, safe for everybody, right? And then added to that, we can always use lubrication, because many of the hormone, the estrogen, is going to help keep the vaginal wall tight and strong. It may not be 100% with the secretion that you may need during intercourse, right? So that's where we add also lubrication.
Yeah.